a need for us to talk about COVID-19. There's been a sharp rise in infections and in cases, particularly in Ghana, prompting fears of a possible fifth wave. Now, government lifted most of the COVID-19 restrictions and other measures put in place to deal with the spread of the virus. Less than 3 months after those restrictions were lifted, there seemed to be another jump in cases. Well, Joy News has received several complaints from parents about their school children coming home sick, and in some other cases testing positive for COVID-19. There are also a seemingly high number of cold, sore throats and other symptoms as well, which is raising a lot of questions on this COVID-19 conversation again. So are we back to the days of heightened cases? Do we have to revisit the conversation on restrictions and lockdowns as a way of dealing with this case? Joining us via Zoom now is Dr. Da Costa Abuaje, who's with the National COVID-19 Task Force. Thank you so much, sir, for your time. So here we are, we're doing a little over 300 cases now. Is it the case that we're moving into another wave of the COVID-19 infections?
Thank you, and good afternoon to your viewers. I think, yes, over the last 2 weeks, we've seen some increase. Like you rightly said, it's above 300. And I think it's a case that we need to certainly continue to monitor and watch because you know how this virus behaves. So I think we just have to continue to monitor the cases. But the fact is, obviously, there is an intervention that we continue to roll out, which is the vaccination. It is at this point that I will encourage Ghanaians to obviously take it very serious, and those who are not vaccinated to get vaccinated, right, because it is the only way out of this pandemic. Let me also stress that we shouldn't deceive ourselves that COVID is gone. COVID is not gone anywhere. It is still there, but it depends on our collective actions and behavior that will obviously drive the cases or reduce it. So for now, that is what I'll put across.
Yeah, but the point is, what do we resort to now? Moral suasion, or this is the time where we should be heading back into the days of some form of restrictions?
I think we are not there yet. I think some of the restrictions are still there. For example, the face mask. Yes, we are saying that it is not mandatory, but it is not to say that we are not to wear the face mask. So we've seen that the cases are actually coming from enclosed events. They are coming from parties, schools, and you can find some of those enclosed areas in those places. So my advice is that if you are in an enclosed area, please wear your face mask. The hand washing is still very important, and we must stress that, in fact, it should be part of us. We shouldn't just make it one off. The hand washing is very, very good. There were other benefits aside aside me using it to fight COVID. For example, cholera cases were down. Yes, we had a lot of benefits, sanitation improved and other things. So you remember the spraying exercise that we did. So I believe that we have to take a critical look at integrating, obviously, the hand washing into our normal activities. We shouldn't just stop there. And the sanitizing is also very important. The hand sanitizers, we should continue to use them. I think it is out of this that we will get a reduction in cases.
And then we have, for instance, the graphs on the screens right now. Probably you should help us out with the figures. We're seeing probably a rise again in the cases. Clearly, I believe, as a non-expert, that's what the implication is on what we're seeing on the screens right now.
Yes, you are right. Like I said, I can give you a breakdown of where the cases are coming from. But the point is the interventions that are going to help. Obviously, I've said that we want people to be vaccinated. For example, if you look at Greater Accra, for example, as of the 3rd, it was 344. So you remember where we were in about 3 weeks ago. So it means there is a sharp jump, and also the eastern region. So the fact is, we just have to be careful and make sure that we are complying with the same safety protocols that have actually helped us to this end. And this is the time that when you are not vaccinated, you have to find a vaccination center to be vaccinated. Now, for the Ghanaians, we are rolling out the national vaccination campaign starting from the 8th for about a week. And I think that those who are not vaccinated should take advantage of this exercise to obviously get vaccinated. We will do a second one also from 23rd to 27th. I mean, these are measures that we are putting in place to drive uptake and create demand. The fact is, there is no way out than the vaccination and the safety protocols, and we must really be careful as a country.
And since you're talking about the COVID-19 vaccinations, I guess it's a good time to ask about the status of vaccinations across the country.
Yeah, okay. So, I mean, I'll give you some breakdown as well. The last time I checked, I think we had about 15,658,751. That is the dose that we've given to people. We've administered. Now, in terms of people having at least a dose, it's about 9.9, so which represents about 43% of the 22.9 million people that we want to vaccinate. Then also, we have people who are fully vaccinated, about 6.599606, which represents about 28.9% of, again, the 22.9 million that we want to vaccinate. Then there is also the case that people are receiving the boosters. We have over 78305. So that's the update on the vaccination. Now, I think you know our target, as we have said, is 22.9 million, because we've now rolled, we've brought in the 15 years and above. So it has increased our initial target of the 20 million. So it means that we still have, a long way to go. And I'm only pleading with Ghanaians that we should take advantage of the many interventions that we have put in place to get vaccinated, because it's really the way out.
Okay, so let's do this. Let's also break down the areas and where we're experiencing some of these cases. I guess that will give us some context to the discussion that we're having now. And quite a sharp focus there on Greater Accra region, for instance. And if you look at that as compared to the other regions, it appears that the national capital, again, is leading in terms of the infection rate, with some difference of 45, but then I guess they're still leading the Ashanti region. And you look at some of the communities, even within the Greater Accra region, in terms of districts, you see the Ayaso West, for instance, with 12, Accra 10, Ladade Kotopon 7, Adenta is there with 3, we have 2 for Ghana East. We also do have the Kole Klote area, as well as the Lankwantanan Medina area with 2 each, and Shayo Sudoku is as well having 2. But for Ashaman, Ayasu East, Tema West, Tema itself, and Wejagbawe, they all have just 1 case. Is it because we have the airport situated at Ayasu West? Is that why we're seeing such a sharp rise in cases in that district?
Yes, that could be. Ayawaso has always had the numbers up. And bear in mind that is where we have most of our treatment and testing sites. So that could be what is accounting for that. But the most important thing is, 1 case is also very important. It's not to say that 1 is not this thing, because we start from 1 before 2. So the fact is, I will still dwell on the safety protocols, regardless of where you are. And I will also dwell on the fact that the vaccination is very important in helping us out of this exercise.
And Doc, apologies for that. I was actually indicating that the airport was somewhere around I also was. But what I meant to ask was about the airport and why we're not experiencing a sharp rise in the district within which it finds itself as compared to Ayaso West, which is leading that chart now. I guess that's the import of the question I'm putting across.
Okay, so you are trying to say that the cases coming from the airport?
Right. Yeah, the fact is accounting for that largely, yes.
I think I have to obviously look into that, but I don't think the cases are coming from only the airport, if it's so many, because you remember that we've even reduced testing at the airport.
Yeah.
So from what I have, I certainly know that obviously it's coming from the testing sites within the Ayawaso.
But then the airport is no longer testing, and that's why perhaps we're not even recording any case at all. Is that why? Yeah,
but there is an intervention to that. You see, the airport restrictions the protocols are very strict. Now you have to be double vaccinated, you have to be fully vaccinated before you are able to travel to Ghana. So that is a control measure, you see. And if you do not have the vaccination, you have to do a PCR test. And we're still doing the testing. We haven't stopped, just that it's reduced. So I think let me come back to you on obviously the airport data, right. But I can assure you that it is the testing sites and the treatment sites we need Ayawa, so that will be what is accounted
right.
for.
So going forward, what's the advice or caution from the Ghana Health Service for us in the coming days? What should we be on the lookout for?
Okay, so thank you. So like I stated earlier, we are rolling out the 4th vaccination campaign, which is starting on the 8th. And I think that for those who are not vaccinated should take advantage of this to get vaccinated. We also have a number of people who have had their first dose, but not the second dose. So this is their opportunity to take advantage and get, obviously, the vaccines done. We'll continue the campaigns, we continue the education, we continue to do the house to house, but we need the public to go with us, because at the end of the day, we have more vaccines, and if the people are not ready to accept it, then there is a problem. So I don't want to believe that is the case. I just believe that we are obviously doing a lot to make sure that people are vaccinated, and we will create opportunities for people to be vaccinated. Now, aside this, obviously this campaign that is coming on tomorrow, we will be doing another one from the 23rd, but we will also not stop there. No, what we will be doing is that we will be doing active community engagement maybe 2 to 3 weeks prior the national immunization days. So once we do that, we will be able to drive the uptake. So, as it emerges, you have to develop various strategies in making sure that people obviously go with you. So it's exactly what we're going to do to make sure that our people get vaccinated.
All right, then. I guess we'll have to leave that conversation here. But thank you, Doc, for your time here on The Pulse. And obviously, we'll keep an eye on the COVID-19 infection.